Our next speaker is Dr. Simon. And so I'm going to turn it over to you for your comments about the workshop. Melissa?
Thank you so much, Angela. So ditto to everybody. It's always hard to be the last person on this type of a panel. But, I really want to emphasize one key takeaway, and that obesity in populations is a phenotype, a reflection, if I may, of where we are right now in this country. It's an accumulation of decades, a downstream effect of decades of inequities rooted in structural and political racism that has promulgated social, economic, structural determinants of health. And Dr. Kamara Jones summed it up well in her allegories. And the way I see it is that the apple tree is bent towards favoring one group of people or population, so that those people who have this privilege or advantage of the tree being bent towards them does not have to work hard to get those apples. They just fall right into their hands. But then at the same time, the other side of the sign, if I may, like Dr. Jones's allegory in the restaurant, is that the apple has been away from others who may never be able to even get that apple or achieve health. But what we have to be able to see is that the tree is fundamentally bent. And that's what we need more of, people who can see that the tree is bent. And then we have to seek to unbend the tree. And I say unbend and not straighten on purpose, because the tree may not need to be straightened first. It may need to be bent the other way on purpose, because the solution really is that we have to acknowledge that the fundamental definition of health equity, like Dr. Jones stated, is that health equity is the process. It's the process of assurance and not an outcome. And we have to seek to ensure that this process of unbending the tree assures the conditions of optimal determinants of health that are conferred to each and every person while acknowledging historical injustices. And we must then provide resources like access, respect, culturally responsive care, etc., for each of these populations. And individuals actually need to be able to reach or achieve an apple, right? So we have to unbend that tree so people can achieve reaching that apple and thus achieve health. So the onus is on each and every one of us to really look hard at where those trees are bent and seek to unbend the tree. Thanks.